Today is all about the eyes. Let's talk about the 4 things you can do to take care of your eyelid skin. As we know, our eyes actually age faster than any other part of our face. The skin is thin, it has very few oil glands, and we make our eyes do so much. They blink thousands of times a day, they get puffy, we cry, they're incredibly expressionate, and that's what makes them beautiful, but they also do require a little bit of extra TLC. So number 1, the first thing that you can do is prevention. You have to take care of your eyes. You have to put sunscreen around your eyes every single day. If you use zinc-based sunscreen, it's safe to use on your eyelids, even right above your eyelid. Second thing is you have to wear sunglasses. So when you drive, when you're walking down the street, when you're outside in the bright sun, sunglasses are going to keep you from squinting, but they're also going to protect your skin from UV that can break down the collagen around your eyes. Okay, number 2, what are the things you can do at home to protect your eyes? So there are some treatments that will help your eye skin, but it's not necessarily eye cream. I'm actually not a fan of eye cream. I think it is overpriced, and oftentimes eye cream has fewer active ingredients in it than, for example, your face cream, because your eye skin is so tender. So what is ideal is just to be able to have a gentle enough face cream that you can use it around your eyes. The only other thing is if you don't need a face cream because your skin is so oily, you still need to have something to put on your eyes because eyelid skin is not going to be oily. It doesn't have enough sebaceous glands for that. So at home, you need to moisturize around your eyes every night before you go to bed, and that can just be my Dr. Rogers Restore face cream. If my eyes are really, really dry, I'll put on my face cream and I'll actually follow that with my healing balm to really sort of coat and support those ingredients to penetrate into my skin. Now, there are things I always talk about. You need to use a vitamin C serum. You need to use retin-A or tretinoin, and you need to use sunscreen. Those products can be used on your eyelid skin. You just need to use less and be careful because you're going to absorb more through your really thin eyelid skin than you are through your regular skin. So in the morning when I use my vitamin C serum, I creep it all the way up to my orbital rim and I put it out here right where all my crow's feet are. I do not put it on my upper lash line. At night before I go to bed, after I wash my face, I put on tretinoin, I put it everywhere, and I creep it up in those same locations. I then follow those treatments with my face wash, with my face cream, and then sometimes even with my healing balm. And if your skin is irritated at all, you don't do that. And I would say for most people, eyelid skin can only tolerate a retinol or a tretinoin 2, maybe 3 times a week. Okay, number 3. Injectables, things that can be done at the doctor's office. I think the most popular treatment around the eyes is Botox. And what we can do, and get really close, is these little bunny lines. See how I don't have them? That's because mine have been Botox. Crow's feet here, I have Botox around my eyes, but when you smile, it's always gonna push skin up and you're always gonna wrinkle some. So you can open up your eyes with Botox through here or any neuromodulator, and you can actually open up your eyes through here and help with some of the crepiness underneath your eyes, also with a neuromodulator under your eyes. Filler can be used in those areas as well. I find filler less predictable, and it's really important that whoever does your filler uses a very thin product like Bellatero or RH2, something that's very thin that you can refine, that you can inject underneath the eyelid skin and have it not be seen. You always want to be undercorrected. If you are overfilled underneath your eyes, you're gonna look puffy and your eyes are actually gonna look smaller. So I'm using less and less hyaluronic acid injectables underneath people's eyes and doing more and more of something called PRP. And PRP is something that we take from you. So we remove it from your blood, we spin down your blood, and then I inject it around the eyes to stimulate the building of collagen. And there's been a nice study showing that 3 treatments a month apart can make a huge difference. And I actually did it on myself, and you can see at baseline, I don't have a lot of wrinkles. When I smile, they all come back, but I was able to plump up my under eye skin by doing PRP treatment. It's something I offer to my patients, and you do 1 treatment a month for 3 months. Okay, 4th thing. Lasering. Lasering is fantastic for eyelid skin. Really the laser of choice is ablative resurfacing laser. My favorite is the CO2 laser. And just like the PRP, you are going to need multiple treatments, but with a series of 3 treatments, you can actually tighten your eyelid skin so there's less overhang over your lash line, and also build more thickness to your skin underneath the eye. So really, one of the things you need to remember is if you're getting your face lasered with IPL or Fraxel, if you don't laser your eyelids, what's gonna happen is the skin that already is more youthful is gonna continue to look better, and your eyes are gonna look like these crinkly little raisins. So if you are doing a lot for the rest of your face, you do need to invest in taking care of your eyes so that everything is congruous. Because one of the things with the anti-aging movement or restoring more youthful skin movement is if you don't take care of everything, meaning your eyelids, your face, your neck, your chest, you can actually start to look kind of weird because you have areas that look 10 years younger than other areas. And I think beauty is really about being uniform and consistent. We don't want to have huge cheeks and wrinkly old lips. Just like that, you don't want to have beautiful, smooth cheek skin and wrinkly old eyes. Either let everything wrinkle and enjoy that beautiful sort of history of all the things you've experienced in your life, or make sure to do a little bit everywhere so you continue to look like yourself, but not fragmented. Other questions for me? And then lastly, you could always have surgery. You could have an eye lift or a blepharoplasty where they actually go in and cut out the skin, sometimes even remove some fat to make your skins look more uniform. I'm not a big fan of plastic surgery, but I will say that a blepharoplasty or eye surgery is one of the safest ones out there, and I have seen beautiful results with it. So in summary, first and foremost, prevent. Wear your sunglasses, wear your zinc-based sunscreen. Second, at home, yes, creep your antioxidant, creep your retinol up to your orbital rim. Make sure you follow that with a nice thick moisturizer. You do not need to spend hundreds of dollars on an eye cream. Eye creams rarely do more than a well-formulated face cream, and that's the reason why I will never have an eye cream. You can just use my face cream around your eyes. In the office, you can do injectables, which are neuromodulators such as Botox, as well as fillers. I like hyaluronic acid fillers around the eyes, but they need to be exceedingly thin, or else you can see lumpy bumpiness underneath the eyes. My new favorite thing to inject underneath the eyes is PRP, which I love when I can use your own body to do the work. And then in addition to that, there's lasering. It's the CO2 laser. It usually requires multiple treatments. Now when I CO2 laser people's eyes, I always do it with PRP because the results are significantly better. And lastly, if you just want a rapid fix, that's where eye surgery can be a wonderful thing for people. All right, let me know if you have any questions.